MPN Voice is a patient charity that was set up in 2005 by myself, my colleagues, and some patients at Guy's and St Thomas's Hospital, where I work in London in the UK. And the original plan for MPN Voice, which then was known as MPN Support, was just to provide accurate information for patients with MPNs. One of the striking things for me was that the lack of information that was available. But then from that tiny little acorn, a big oak tree has grown and is surrounded by, if you like, a forest of other patient advocacy groups now. And so as of today, MPN Voice has many different functions. Mainly it serves patients in the UK, but also has patients who touch the online community, which is a chat room function called Health Unlocked, which is linked to the National Health Service in the UK, has patients attending forums. So we've had over 2,000 patients in 2019 at least attending forums. And so it provides support, information, a way for patients to meet, both face-to-face but also virtually, and then also advocacy, so supporting and providing a patient voice in reimbursement questions, most obviously with NICE in the UK, but also in Scotland, Wales and Ireland, and if needed elsewhere in providing patient input. MPN Voice also has representation on national groups driving the research agenda for patients with MPNs as well, and supported, for example, the Landmark survey, as well as some of our other national and international trials. So clinical trials, specifically in MPN, can mean a number of different things. And I think that, many patients are keen to that their disease experience, that their story provides some more knowledge for people working in the field, and for patients who are less well as a result of their MPN, they may be looking for a new therapy or a new advance in the disease. So a clinical trial can be anything from something where we're really testing a very, very new agent in a so-called phase 1 trial, so we don't know if it works, we don't know about the dose, to randomized trials where the patient knows what treatment they're getting, to a placebo trial where they don't know. But it can also include, and very important insights will come from things like filling in questionnaires about your experience with the disease. For example, the Landmark study yielded a lot of important information about the impact of MPN on our patients' ability to work, the impact on their family, etc. That is still, it's not really a clinical trial, but it's still research in the broadest sense. And then there are other aspects which, groups in Austria and across Europe and the UK are really very strong on, which is collecting information and also collecting samples so that you can link the way that the disease behaves with some studies on the biology of the disease. And this is how, for example, in Europe, we've been able to describe the JAK2 V617F mutation, CALR mutations, and sometimes to be able to, more recently, for example, link this to responsiveness to therapy and also to prognosis. So patients often ask, how can I get information about a clinical trial or clinical research in the more broad sense? And I think the first starting point for that is to speak to the medical team that's looking after you. And they should be linked into all of the different aspects of locally and nationally in their country that are available. You can also, for example, go and look at MPN Voice has a section on active clinical trials, and some of the hospitals in the UK will provide information about trials that they're running. Another important area where a patient can go to look is on the ClinTrials Gov website, and this is a website which hosts a lot of information about clinical trials, but it can be a little bit unwieldy to search unless you really know what terms you want to look for. The idea of, one website where you can find all the information about research is a great one, and this is something that we've been trying to look at doing even as an institution at Guy's and St Thomas's and our partner research organisations. And it sounds absolutely fantastic and amazing, but the problem is keeping it up to date and also the amount of information that is required. So you immediately might see, for example, here is a great study on this new drug that will help with fatigue. We know fatigue is a massive issue for our patients with MPN. And then you see that that's there, but you want to find out, well, what's the drug, what's the side effects, what do I need to be, how does my disease need to be in order to be able to take part? So you need to be able to find more and more and more information, so it's not just a list. I think the most comprehensive listing is on clintrials.gov. But then actually going and asking your healthcare team or looking at national resources, because they will all be slightly different. In Scotland, there are very clear resources that are helpful, but Scottish patients, for example, can go elsewhere if they really need to find information on a trial. So worldwide, I think we're in a really powerful position and a really strong position to deliver important advances for patients with MPNs. And these advances and research really stem across the entirety of the diseases. So, for example, there are lots of different clinical trials looking at combinations of drugs for patients with myelofibrosis, looking at trialing drugs earlier in the course of myelofibrosis. There are agents, things looking at what are the right endpoints. Can we use PET scanning, for example, to look at activity of the disease? So I think right at the kind of cutting edge for myelofibrosis. Then there are lots of important studies coming for patients with polycythemia vera, even patients who are resistant or intolerant to standard therapies. And then also the question about using agents earlier in the course of disease. So I was very interested to see Professor Barboui, for example, presenting the data on the low-risk ET. But I think we also have some gaps here in terms of looking at patients and looking at our ability to prevent transformation events. So this is for PV and ET, and that there are some challenges there because you need to study a lot of patients and you need to follow them up for a really, really long time. Also, in terms of research, there are many different initiatives to share information and to share samples and pull together data for many thousands of patients so that we can develop many more powerful tools to look at prognosis, the way that patients their disease will progress, for example, the way that they might respond to therapy. Maybe also looking at gene therapies and cellular therapies. So there's been some really powerful information from the group of Robert Kralovics and others, for example, in Denmark, looking at maybe how we can use immunotherapy in MPNs. We haven't really been doing that very successfully. So I think, that's perhaps sounds like a massive enterprise with, very complex interactions between clinicians, patients, basic research. But that really is how connected the world is and how connected researchers, clinicians, patients really should be, so that we can pull together and really try to understand where the priorities should be, where the opportunities are.